Alright, welcome to Jbell Entertainment TV. I am Shane Reed, and this is a community service announcement on the novel coronavirus. So this is an initiative by Jbell and of course Junior Chamber International Jamaica. So what is a novel coronavirus? A novel coronavirus is a new strain of coronavirus. The disease caused by the novel coronavirus, first identified in Wuhan, China, has been named coronavirus disease 2019 or COVID 2019. CO stands for corona, VI for virus, and D for disease. Formerly, this disease was referred to as 2019 novel coronavirus or 2019 N, capital C, common O, capital V, and in quotes. The COVID-19 virus is a new virus linked to the same family of virus as severe acute respiratory syndrome, SARS, and some types of common colds. It's the same family. How does the COVID-19 virus spread? And I'm reading from the UNICEF website, so this is a credible website. The virus is transmitted through direct contact with respiratory droplets of an infected person, generated through coughing and sneezing, and touching surfaces contaminated with the virus. The COVID-19 virus may survive on surfaces for several hours, but simple disinfectants can kill. What are the symptoms of coronavirus? Symptoms can include fever, cough, and shortness of breath. In more severe cases, infection can cause pneumonia or breathing difficulties. More rarely, the disease can be fatal. These symptoms are similar to the flu, the common flu, influenza, all right, which are a lot more common than COVID-19. This is why testing is required to confirm if someone has COVID-19. Okay? It is important to remember the key prevention measures are the same: frequent hand washing and respiratory hygiene. Cover your cough or sneeze with a flexible elbow or tissue, and then throw away that tissue in a closed bin. Also, there is a vaccine for the flu, so remember to keep yourself and your child up to date with vaccination. This vaccine is a flu vaccine, not a COVID-19 vaccine. So, how do I avoid the risk of infection? Here are 4 precautions you and your family can take to avoid infection. Wash your hands frequently using soap and water or an alcohol-based hand rub. Cover mouth and nose with flex elbow or tissue when coughing or sneeze. Dispose of used tissue immediately. Avoid close contact with anyone who has cold or flu-like symptoms. Seek medical care early if you or your child has a fever, cough, or difficulty breathing. So, some questions and answers. Should I wear a medical mask? These are popular now. The use of a medical mask is advised if you have respiratory symptoms, coughing or sneezing, to protect others. If you don't have any symptoms, then there is no need to wear a mask. If masks are worn, They are to be used and disposed of properly to ensure their effectiveness and to avoid any increased risk of transmitting the virus. The use of masks alone is not enough to stop infections and must be combined with frequent hand washing, covering sneezes and coughs, and avoiding close contact with anyone with cold or flu-like symptoms. All right, coughing, sneezing, fever. Does COVID-19 affect children? This is a new virus and we do not know enough yet about how it affects children or pregnant women. We know it is possible for people of any age to be infected with the virus, but so far, there has been relatively few cases of COVID-19 reported among children. The virus is fatal in rare cases. So far, mainly among older people with pre-existing medical conditions. What should I do if my child has symptoms of COVID-19? Seek medical attention. But remember, this is a flu season in the northern hemisphere where we are located. And symptoms of COVID-19 such as cough or fever can be similar to those of flu or the common cold, which are a lot more frequent. Continue to follow good hand and respiratory hygiene practices like regular hand washing, and keep your child up to date with vaccinations so that your child is protected against other viruses and bacteria causing diseases. What should I do if a family member displays symptoms? You should seek medical care early. All right? If you think that it's COVID-19, call ahead and inform your doctor. Should I take my child out of school? If your child is having symptoms, seek medical care and follow the instructions from the health care provider. Otherwise, as with other respiratory infections like the flu, keep your child well rested at home while symptomatic and avoid going to public places to prevent spread to others. What is the best way to wash hands properly? Step 1, wet your hands with running water. Wet hands with running water. Apply enough soap to cover wet hands. Scrub all surfaces of the hands, including back of the hand, between fingers and under nails. Yes or no? Under nails? Yes, under your nails. For at least 20 seconds. Rinse thoroughly with running water. Dry hands with a clean cloth or single-use towel, and then you dispose of that. Wash your hands often, especially before eating, after blowing your nose, coughing or sneezing, and going to the bathroom. If soap and water are not readily available, use an alcohol-based hand sanitizer with at least 60% alcohol. Always wash hands with soap and water if hands are visibly dirty. What precautions should I take if I travel? If I take my family and we travel. Anyone planning a trip overseas should seek or check the travel advisory for their destination country for any restrictions on entry, quarantine requirements on entry, or other relevant travel advice. Can pregnant women pass coronavirus to unborn children? At this time, there is not enough evidence to determine whether the virus is transmitted from a mother to her baby during pregnancy or the potential impact this may have on the baby. This is currently being investigated. Pregnant women should continue to follow appropriate precautions to prevent themselves from exposure to the virus and seek medical care if experiencing symptoms such as fever, cough, or difficulty breathing. Is it safe for a mother to breastfeed if she is infected with coronavirus? All mothers in affected and at risk areas who have symptoms of fever, cough, or difficulty breathing should seek medical care early and follow instructions from a healthcare provider. Considering the benefits of breastfeeding and the insignificant role of breast milk in the transmission of other respiratory viruses, the mother can continue breastfeeding while applying all the necessary precautions. For symptomatic mothers well enough to breastfeed, this includes wearing a mask when near a child, including during feeding, washing hands before and after contact with the child, including feeding, and cleaning, disinfecting contaminated sources, as should be done in all cases where anyone with confirmed or suspected COVID-19 interacts with others, including children. If a mother is too ill, she should be encouraged to express, which is squeeze the milk and give it to the child via a clean cup or spoon, and all while following the same infection prevention methods. So that's from UNICEF. All right, so I'm going to World Health Organization, WHO, and we're going to be talking now about some myth busters. So we're going to be dispelling, breaking up all the something then when I go so. All right. Cold water and snow cannot kill the new coronavirus. There is no reason to believe that cold water can kill the new coronavirus or other diseases. The normal human body temperature remains around 36.5 degrees Celsius to 37 degrees Celsius, regardless of the external temperature or weather. The most effective way to protect yourself against the new coronavirus is by frequently cleaning your hands with alcohol-based hand rub or washing them with soap and water. Okay. Taking a hot bath does not prevent the new coronavirus disease. Simple. Wash your hands. Do not touch your eyes and all of these things. So taking a hot bath will not protect you. It can end up damaging your skin, etc., etc. So please don't do that. Right? The new coronavirus cannot be transmitted through goods manufactured in China or any country reporting COVID-19. And I'm going to read this. Even though the new coronavirus can stay on surfaces for a few hours or up to several days, depending on the type of surface, it is very unlikely that the virus will persist on a surface after being moved, traveled, and exposed to different conditions and temperatures. If you think a surface may be contaminated, use a disinfectant to clean it after touching it. Clean your hands with alcohol-based hand rub or wash them with soap and water. The new coronavirus cannot be transmitted through mosquito bites. Mosquito 1, mosquito 2. To date, there has been no information nor evidence to suggest that the new coronavirus could be transmitted by mosquitoes. The new coronavirus is a respiratory virus which spreads primarily through droplets generated when an infected person coughs or sneezes. What do you sneeze there? Sneeze. Or through droplets of saliva, spit, or discharge from the nose. Okay? To protect yourself, clean your hands frequently with an alcohol-based hand rub or so wash your hand. Okay? And don't contact with anyone who will sneeze and cough. Are hand dryers effective in killing the new coronavirus? Well, do you want to use a hand dryer? No. Hand dryers are not effective in killing the 2019 COVID. To protect yourself against the new coronavirus, you should wash your hands. Alright? So don't use no hand dryer. I use alcohol-based liquid. Can ultraviolet disinfection lamp kill the new coronavirus? No. You're exposing yourself to UV radiation that can cause skin irritation. So don't use ultraviolet disinfection to do that. Cannot kill. Okay. How effective are thermal scanners in detecting people infected with the new coronavirus? And this is important, so I'm going to read this. Thermal, which is found at the airport. Thermal scanners are effective in detecting people who have developed a fever, i.e. have a higher than normal body temperature because of infection with the new coronavirus. However, they cannot detect people who are infected but are not yet sick with the fever. This is because it takes between 2 and 10 days before people who are infected become sick and develop a fever. Can spraying alcohol or chlorine all over your body kill the new coronavirus? No, it cannot. Spraying alcohol or chlorine all over your body will not kill the virus that have already entered your body. Spraying such substances can be harmful to clothes or mucous membranes, example in your eyes and mouth. Be aware that both alcohol and chlorine can be useful to disinfect surfaces, but they need to be used under appropriate recommendations. Can pets at home spread the new coronavirus? At present, there is no evidence that companion animals, pets such as dogs or cats, can be infected with the new coronavirus. However, it is always a good idea to wash your hands and with soap and water after contact with pets. This protects you against various common bacteria such as E. coli and salmonella, that can pass between pets and humans. Okay. Do vaccines against pneumonia protect you against the new coronavirus? No. Vaccines against pneumonia, such as pneumococcal vaccine and Haemophilus influenza type B (HIP) vaccine, do not provide protection against the new coronavirus. The virus is new and different, and it needs its own vaccine. Researchers are trying to develop a vaccine against the 2019 COVID, and the World Health Organization is supporting their efforts. All right? Can regularly rinsing your nose with saline help prevent infection with the new coronavirus? No. There is no evidence that regularly rinsing your nose with, I think this is saline, has protected people from infection with the new coronavirus. Can eating garlic, and boy, Jamaicans, garlic can solve everything. Can eating garlic help prevent infection with the new coronavirus? Garlic is a healthy food that have some antimicrobial properties. However, there is no evidence, none at all, from the current outbreak that eating garlic has protected people from the new coronavirus. Does the new coronavirus affect older people, or are younger people also susceptible? People of all ages can be infected by the new coronavirus. Older people and people with pre-existing medical conditions such as asthma, diabetes, heart disease appear to be more vulnerable to becoming severely ill with the virus. WHO advises people of all ages to take steps to protect themselves from the virus. For example, by following good hand hygiene and good respiratory hygiene. Are antibiotics effective in preventing and treating the new coronavirus? No. Antibiotics do not work against virus, only bacteria. The new coronavirus is a virus, and therefore antibiotics should be used as a means of prevention. Should not be used as a means of prevention or treatment. Okay? Are there any specific medicines to prevent or treat the new coronavirus? To date, there is no specific medicine recommended to prevent or treat the new coronavirus. So, those are the myth busters. For those of us traveling, and this is a somewhat long tape or long video, but I think it is important for us because with all the panic that is going around, we need to know the facts. So for those of us who travel or who will be traveling, here are some countries or territories outside of China which they have confirmed cases of COVID-19 and deaths. So they have confirmed cases and death. So of course you know that China on a whole and a lot of provinces, and I'm not even going to go through the provinces in China, but a lot of provinces in China have coronaviruses and confirmed deaths. But for countries, Republic of Korea, Japan, so this is in the Western Pacific region. So Republic of Korea, Japan, Singapore, Malaysia, Australia, Vietnam, Philippines, New Zealand, Cambodia. European region, Italy, Germany, France, Spain, Switzerland, the United Kingdom, Netherlands, Belgium, Sweden, Norway, Austria, Greece, Ireland, Denmark, San Marino, Czechia, Israel, Portugal, Finland, Ireland, Romania, Georgia, Slovenia, Croatia, Estonia, Azerbaijan, Hungary, Russian Federation, Belarus, Poland, Malta, North Macedonia, Slovakia, Bosnia, Bulgaria, Luxembourg, Andorra, Armenia, Holy See, Latvia, Liechtenstein, I think it is, Lithuania, Monaco, Republic of Moldova, Serbia, Ukraine. All right. Territories: Faroe Islands and Gibraltar. Southeast Asia region: Thailand, India, Indonesia, Maldives, Bhutan, Nepal, Sri Lanka. Eastern Mediterranean region. This sounds like the whole world. Iran, Islamic Republic of Iran, Kuwait, Bahrain, Iraq, Egypt, United Arab Emirates, Lebanon, Oman, Qatar, Saudi Arabia, Pakistan, Afghanistan, Morocco, Jordan, Tunisia. Territories: occupied territories, Palestinian territory. region of the Americas, which is our region. United States of America, Brazil, Canada, Ecuador, Argentina, Mexico, Peru, Chile, Costa Rica, Colombia, and Dominican Republic. Territories: French Guiana, Martinique, Saint Martin, and Saint Bartholomew. African region: Algeria, Senegal, Cameroon, South Africa, Nigeria, Togo. Okay? So those are the countries that there are suspected cases. There are confirmed cases of COVID-19, and not all of these countries have, let me see, not all of these countries have deaths, and I'm going to go through. Yeah. So let me see. Yeah, so not all of these countries have deaths. Yeah. So I'm looking at it, and Germany, and this is from the World Health Organization website. Germany doesn't have any. Let me look. Turkey, nope. Germany doesn't have any. Belgium doesn't have any. Sweden doesn't have any. Norway doesn't have any. Austria doesn't have any. All right, so please, public service announcement from Jbell Entertainment TV and from Junior Chamber International Jamaica. I know it is long, but please be informed. All right, and please be safe and stop spreading rumors and causing panic. All right, cool. Bless you. That's it from us, and we love you all. And please let us take care of ourselves and take care of each other. All right, Jbell, JC, I love you.